So we have a super exciting episode this week on Hi, I'm Doctor. We have Dr. Wendall Mascarenhas. Wendall is a OMFS MD from McGill. Recently appeared on a finance podcast, which is, of particular interest to us because we just want to pick your brain about that. So welcome to the show.
Awesome. Thanks for having me. I'm a big fan.
So why don't you just start off with giving the listeners just the 30,000-foot view of your dental journey?
Yeah, sure. So I'm born and raised in Toronto. So I went to York for undergrad, and then I got into Western Dental School. So I did my dental school there. Around, I'd say, first, second year, I heard about oral surgery and was really interested. So you start the whole path of, you do externships, you do research, you try and, shadow oral surgeons, and I fell in love with it. So by the time I got to fourth year, I really knew I wanted to do that. So I did a GPR at Western with the aim of getting more oral surgery experience and applying to oral surgery programs across Canada and the US. I was fortunate enough to get into McGill's program. It's a 6-year combined program. So 2 years is med school. You do the clerkship and get your MD, and 4 years is like your normal oral surgery training. Once again, by the end of my 6 years of residency is when I really fell in love with corrective jaw surgery or orthognathic surgery. So I applied for a fellowship in the US in Charlotte. So I did a 1-year fellowship in the US where we just did nothing but jaw surgery, like 300 cases in a year. And that's kind of what my practice specializes in now, along with, the bread and butter oral surgery stuff. So that's kind of where I've been. I always joke with my patients because, a lot of patients will say, oh, how long have you been doing this? Or how old are you? I just say, listen, I did 14 years of school. You don't want me to keep going back to school and training more than this. I've done enough, trust me.
Man, what's residency like in comparison to dental school? Is it just all hands-on, or are you still doing classroom stuff?
So there's not a lot of classroom stuff that's traditional that you would think about, like in dental school. I would say dental school is a ton of fun. You're with, you figured out your profession, you're in a class, you form your group of friends, you just have a ton of fun. And then, as you advance in dental school near the end, it gets a little more stressful because you're starting clerkship, you're working with real people, real patients, to develop your hand skills. Residency in oral surgery is a bit different, especially in Canada. There's only 6 spots for English-speaking oral surgery residents in all of Canada. So when you apply and you go to Canada, what you quickly realize is where you thought you were in dental school has nothing to do with where you are in oral surgery. I got to McGill thinking, okay, I'm used to doing well in dental school. I'm pretty confident with my abilities. And then you just get kind of punched in the mouth right away where you're like, wow, I might be the dumbest person in this room for maybe the first time in your life. It's crazy to think about.
Yeah.
But it's a lot of hands-on. You're rounding, you're doing operations, you're assisting, you're treating people in clinic, you're dealing with medical issues. But although there is a strong didactic component that you have to learn, a lot of that is self-taught after hours. Most of your hours at the hospital are spent doing hands-on training because, 6 years sounds like a long time, but you need to become proficient and learn all of oral surgery in 6 years. So it's a lot to do.
For sure. I mean, listen, we're all 3 of us are in different stages of our career. I'm obviously still in dental school. So, I look around and I see time going by slower because I see, oh, this friend's getting married. This friend just bought a house. This friend, is having this milestone moment. I wonder, when you're going through this 14 years of school, does time start going by slower as you get to the tail of it? Or are you just so busy that you can't even think about that?
Yeah, it's strange. I actually found time went by pretty fast because there's so many milestones that you're progressing through at a fast rate. You think about dental school and you've gone from frost week in first year to all of a sudden you're treating patients in second and third year to all of a sudden you're doing your first extraction and then you're doing your first there's always that milestone to look forward to. So I had a blast. It went by really fast. And then when it came to residency, you're so busy. It's weird. I find the days are long. You're getting up so early and you're going to sleep so late and there's so much to do. So each day feels really long. But when I look back, I can't believe I was in Montreal for 6 years. It flew by. During that time, I got married. We were getting ready to have our first kid. There's so much happens during that 6 years. It's really formative. So I actually would say, time goes by pretty quickly. I didn't find it slowed down for me at all, to be honest. We were just too busy.
Man, I've always wanted to ask an oral surgeon this. I've been practicing for 14 years now. And I take out a lot of teeth, probably 1% of the amount of teeth you do. But what stresses you out? I know what stresses me out. I'm stressed out daily. What stresses you out that you've been through all of it? What still gets your goat?
So I would say for me, I'll be honest with you, working in an academic setting, teaching at U of T, you know, being in the OR once a week, what stresses me out or what makes me think a lot more is when you get those unique cases. Like the unique cases, when I look at a PAN, I look at a Ceph, I look at a CT, and not your jaw drops, but your eyes go wide. You're thinking, wait, let me scroll through it again. What is going on here? And it's happened before. You know, it's happened since I've been in private practice and working as a staff. I would say in private practice setting, you know, dental extractions, implants, stuff like that, nothing really stresses me out that much anymore because, as you said, you have the reps, you feel like you've done everything. I think once you get comfortable with the instrumentation and the drills and working with patients, I'll be honest with you, the only thing that stresses me out right now is being a business owner or owning a practice and dealing with staff and scheduling and hours and staff meetings and, you know, sick leave, vacation, all that stuff. That's what's stressful for me is the HR component, because we don't really learn that. But luckily, the surgery side, I find you get kind of in a routine, and I don't find the surgery is very stressful anymore.
Yikes, you and every other dentist, just the HR thing just comes up over and over again.
I'm glad you feel the same pain we do.
Always, yeah.
So like what comes after those 14 years? Because you've kind of put in the grunt work, you've paid your dues, and now it's kind of like that atmospheric effect where you just kind of leave. So like what happened next for you?
So basically, I think when you graduate, either from dental school or from oral surgery, you have to decide what type of practice you want to join or what type of career you want to have. You know, for me, I did so much training, I felt it was going to be a waste to just set up shop in a private practice and do nothing but teeth and titanium all day, because I would have foregone all the skills that I learned in fellowship and in my residency. Like I never would have done any of the trauma that I learned, any of the pathology, any of the jaw surgery, like all of that would have been gone. Because the truth of the matter is if you don't keep that up, you lose those skills really quickly. Then you lose your confidence, as Neki was saying, and then you get stressed out about it and you don't want to do it anymore. So right head on, I jumped in right away and said, let me get on staff, let me take call at hospitals, let me try and get some OR time and continue doing these major surgeries. I think you have to look at practices. Do you want to join a group practice? Do you want to join a solo office and take over? Do you want to do a partnership? Do you want to join a corporate office? There's all these different options that are available to graduates. And similar to dental school, I think you need to find something that matches your personality and the type of job you want to have. I have really close friends of mine that want to show up to work, and then leave. They don't think about work. They don't do any work. They're not responsible for anything as soon as they walk out the door, and they love their life. And then, you know, for me being an owner, the office closes at 5, but you're there till 7 doing paperwork, scheduling, referrals. I mean, you guys kind of know how it is from the people that you work with. So I think it comes down to what you're looking for and what type of practice you want to join. And the advice I would give your listeners is it's okay to be wrong the first time. You know, it's okay if you thought you wanted something and then you get there and you don't like it. Like, it's okay. Just don't commit your life to the first thing you decided when you graduated dental school. Work there for 2 years. It's not working out. Try something else. Like, no one's going to hold you back from trying multiple things.
Totally, man. And I think that's sage advice, because I've been in those scenarios where sometimes you don't know what you don't know until you get there, right?
Mm-hmm.
But I think the same goes for being a dentist. Like I'm a GP and I'm proud to be a GP, but the first year when I graduated, you have this false sense of confidence because you just finished 4 years of school. But like I was telling Akil, you've just finished 4 years of learning enough, just enough not to kill a patient. That's all you learn, right? You know what I mean? So when you graduated from oral surgery, did you feel, I know you get a lot more training, but that like you don't know what you don't know until you get into it. Mm-hmm. Did that same feeling happen to you?
So the nice thing about oral surgery residency I found is you spend 6 years realizing what you don't know. I don't find it similar to when you graduate dental school, because there's still like a whole world of dentistry to explore and the business side and all that type of stuff. And oral surgery for 6 years, every single day, you're meeting patients and cases and going to the operating room and on call, just constantly being reminded, you haven't learned this yet. You don't know this yet. You're not a master of this yet. That person's better than you. That staff has been doing this for 10 years. Although there's a lot of like learning more, for me, I found I corrected a lot of that during my fellowship. I think if I had just graduated oral surgery and went off to work, I would have been really far behind and my confidence level wasn't that high. As soon as I did a fellowship, the beauty of a fellowship is, you know, they know you're a graduate oral surgeon. You're not a resident. So you're taking primary call. You're the staff for cases. You're supervising residents. You're teaching. it kind of is a nice bridge between residency, where you're constantly supervised, to becoming a staff where you're the one supervising people. But I think my confidence level pre-fellowship and after, it's just one extra year, it totally changed my life and gave me a lot more confidence to do these major surgeries that I now feel a lot more comfortable about.
Awesome. Yeah, the good old Dunning-Kruger effect, right? Well, you don't know what you don't know, and you're more confident about what you don't know. So,
Yeah.
but I mean, like I said at the beginning of the pod, I loved your episode with Cameron and Ben at the Rational Reminder podcast, because I was listening to it, and I remember I was in a walk and I was listening to it and I was like, man, this guy's an oral surgeon. Like, he's kind of like one of us, and you're speaking like you're like a financial advisor, or someone that has a degree in finance. So how did you, just to piggyback off of Necky's question, how did you know what you didn't know about finance and in that sort of realm of things?
Yeah, so I'll start out by saying that, I didn't know anything about finance when I was growing up at first. You're kind of a product of your upbringing, or the school you went to, or your friends, the people you talked to. I was super fortunate that my dad is the one that taught us growing up. So my dad would be your prototypical person right now that doesn't know anything about finance and is trying to explore and, falling for all the tricks and falling for all the traps and, making every mistake in the book. My dad literally made every single investment poor decision you can make in your entire life. Like,
I gotta
you
meet
name
this
it.
guy. He just sounds like me, man. Like we are just kindred spirits. I like him already.
Yeah, luckily my dad didn't grow up like in the time of options and crypto and all this other fancy stuff that you can lose your money on now. But he'll be the first to tell you he made every mistake in the book. So growing up, he would have like monthly meetings with me and my three siblings saying, this is what a savings account is. This is what a checking account. This is what a stock is. This is what a bond is. When my dad was growing up, there was no such thing as index funds. Now there's index funds. Now, more recently, there's asset allocation index funds, making your life even easier. That didn't exist when he was growing up. So I think investing has become so much easier, but I never would have known any of it if it wasn't for my dad, because he taught us all of it growing up and taught us all the mistakes to make. So when you go to dental school and you have that free lunch where they're raffling off an iPad sponsored by some bank, well, why are they doing that? They want to get you all as clients. They want you to invest with them. And right away, because of my dad's training, you're taught to think, okay, but what's in it for them? Why are they doing this? Why are they giving to us for free? There's got to be a catch to it. So I think that's what really, really helped me out, is just my dad teaching us as we grew up to learn more and more about finance. And then if you're interested in it, as soon as you get the bug, you can read books, you can listen to podcasts. There's so much information out there now.
Wendell, I like I said, me and your dad were homies already, because I feel like I've made so many mistakes, whether it's trusting other people with my money and they've invested it in just trash, and then the market tanks, and then me wanting to do it on my own, and then I get too nervous to really put it, like, to diversify it properly. And then, like, I kind of went on the same journey as you, as I'm trying to learn as much as I can. But at the end of the day, I ended up not having the confidence to do it all myself. So I do have a couple different asset managers to help me out. But how did you get over that? Like, hey, I'm going to just manage this all on my own. I'm a dentist, but I'm still going to focus a little bit on investing.
I think it's important to and I think one of the benefits of being a specialist myself is I value expertise, right? I love people that specialize in something.
Absolutely.
We're dentists. We specialize in one thing, and then I became an oral surgeon. So now I specialize in a subset of a small thing. So for me, I think it came down to, what's complex, what can I understand? And most importantly, what is worth my time? Like, even if you understand something and can do it yourself, is it worth your time to do it, right? So, for example, if I take an hour to do something now, okay, sure, I did an hour and I did it myself. But is that an hour where I could have done a surgery instead? Is that an hour where I could have hung out with my kids instead? What is the value of that time that I'm spending on this task? So for certain things, if they're super, super simple to me, like managing my RRSP, well, I'll just do it myself. It takes 5 minutes a year. It's not hard to do. On the contrary, I'm incorporated. I have to do tax filings. I have to do, corporate filings and statements. I don't know how to do any of that. That's so complex. It would take me months to figure out how to do that, right?
I thought you were just going to say you file your own taxes. And I'm like, oh my God, this guy.
No, I mean, I would think about it. We could all learn to do it, right? We could do it if we really wanted to, but it would take me forever. I'd probably mess up along the way. Whereas there's accountants that specialize in taxes for dentists or specialists. Like, why not hire them, pay them their fee, and let them do it for me? And obviously you keep track of them to make sure they're doing a good job, but we're in a profession where people come to us to pay us to do a specific task because we specialize in that. So I think for me to not then be okay with paying someone else to do a task they specialize in would be a bit hypocritical. So I think I got the confidence to invest myself just because I find investing is incredibly simple nowadays with like broadly diversified, low cost index funds. Like it really doesn't take a lot to do. And I hire people to do everything else. So accounting, financial planning, dealing with your mortgage, corporate loan, all that stuff. I hire people to help practice valuations. I purchased a practice in Brampton. I'm not an expert in that, so I hire someone. But I think for investing, luckily I have a resource in my dad that if I ever have a question, I ask him first and he'll usually tell me what to do.
That's so awesome. One thing that I picked up from your podcast, the Rational Reminder, and for those listeners that aren't familiar, the Rational Reminder podcast is hosted by Cameron Passmore and Ben Felix, and it's probably one of the biggest business or at least investing podcasts in Canada. So you really held your own on a podcast like that. I would be, shaking in my boots. But
thanks.
One thing that I noticed was that, you even had an investment philosophy. And I mean, I sort of, as a novice to investing, I sort of usually say, okay, firms have investment philosophies. I've never heard of an oral surgeon or a dentist have an investment philosophy. So why don't you walk the listeners through at a pretty basic level what that philosophy is?
My philosophy is, to keep it simple and keep your costs down. I think in the world of investing, what you quickly realize is when you're chasing returns or chasing active management, picking stocks, picking funds to try and outperform the market, you can get bogged down in fees and costs. And if you follow an evidence-based investing approach, which I strongly believe in, because, think of it in our profession, we follow the evidence, we strongly believe in evidence. What it shows is that consistently every single year, 85% of active managers underperform the market. So you're thinking, okay, so 85% of people fail. So 15% of people beat the market. Okay, that's fine. That makes sense to me. If I can get over that fact, I'll just find the 15% of people that are beating the market and pick them. But then you look at persistence, and every year, it's not like that same 15% is performing every single year. Every year, 25% of that 15% will actually outperform the next year. So now you have to find the 25%, it just becomes a chain, it becomes a ladder, it becomes harder and harder. Whereas what the evidence says is, forget picking stocks, forget active funds, just buy the whole market. Buy every single stock that exists, which, you can buy a global diversified index fund. So an index fund is just an index of all the different stocks in the entire world, based on their cap weighting. You just buy everything at once. You click the one button, you buy the entire world of stocks. And basically you will beat 85% of active managers every single year. Now, will you outperform the market? No. Why? Because you are the market. You're literally buying the entire market. So the philosophy that I follow is I'm not going to waste time trying to pick managers or have them pick stocks and pay fees to them. I'm just going to buy the entire market. I'm going to pay 0.2% because that's what it costs for a globally diversified index fund. And I will check this once a year just to reinvest extra money that I have. One of the funniest things I tell people is I never check the stock market. Like literally, I could not tell you today if it's up, down. I don't know what the yearly trend is. I joked with Cameron and Ben on that episode that the only reason I knew the market was down 20% that year is because they said it on their podcast and I listened. Like, I don't know. I don't check this portfolio. I don't check anything because I own the whole market. You're a long-term investor and it doesn't matter if it's going up or down because in the long run, things will go up over time. So that's kind of my philosophy that I've followed. And I think more and more Canadians are kind of gravitating towards it because it's known as the Canadian couch potato method that people find really, really popular. And the best part of it is low fees and low maintenance. You barely have to do anything.
You're speaking my language. I still remember when I was in grade 12, I read do you remember the magazine Money Sense?
Money Sense. Yeah, I have the physical copy, probably right up.
There we go. Now we're talking. Wendell, I knew we were homies, man. Here we go. Okay, Money Sense. I still remember grade 12 reading the couch potato portfolio.
Yeah.
And obviously it changes per age, someone who's young, maybe, 90% stocks, 10% bonds. And as you get older, obviously that goes inverse, right? At your stage in your career, are you it sounds like, are you 100% in index funds? Like in a equity index fund?
Yeah. So basically my formula is very simple. So like an RRSP, your retirement fund, that should be for when you retire. It's 20, 30 years away. So 100% equities. I'm not supposed to touch that money. So why would I care if it's going up and down every day? I need to look at it in 30 years. When it comes to an RESP, I have kids, a lot of your listeners probably have kids. So at the beginning, when they're super young, when they're born, 100% equities. But as they age, when they hit 18, you're going to start needing that money for their education. So it's kind of like what you said, instead of being from as you get older, you're increasing your bonds and decreasing your stocks. For a kid, you're doing the same thing, but it's from 0 to 18. So when they're around 12, you're starting to wean down the stocks and increase the bonds so that when you get to 18, you're very conservative because you want that money in the short term. So that's what I do for my RESPs for my kids. In your own personal account, it comes down to, do you need the money? So if you're saving up for a house, don't put it in the stock market. You need the money for the house.
That's right.
I think the rule of thumb that people use is basically, if you need the money for anything within 5 years, don't put it in the market. Put it in bonds, put it in GICs, put it in a high interest savings account. And that's pretty much what I've been doing. We recently purchased a house. So up until then, our entire house saving fund was just in GICs, so we were using that to just get a guaranteed return, zero risk, like literally zero risk. You cannot lose the money. And then when you're ready to buy your house, the money's there. And then for all our long-term investing, it's all in 100% equities. And as you said, as I age, my allocation to bonds and fixed income will go up and my allocation to equities will go down. But unfortunately, right now I'm 33. I don't need the money right now in the retirement account, at least. Put it in the stocks, try and get a good return on it.
Yeah. Wendell, I wish I had your discipline, because what happens is I go on CNBC every day. I'm reading the news. Neki, Meta went up 26%. Today. Boom, I should buy some Meta tomorrow. Damn, went down 15% the next year. And I get caught and I'm like, oh, I got to invest in here. And I like this asset class and I read too much. I love investing and I read so much, but that's my downfall, is because I try to get ahead of the next wave and I get beat up every time. You
bring up a good point there, because what's tough is that you've acknowledged right there you love investing, so you love reading about it. And I think that's a good thing. It's good to have a passion. It's good to like it. The problem you encounter is the more you read, the more FOMO you have, the more you want to get ahead of the curve.
That's exactly what I'm talking about.
And even for me, I'm not immune to it. I have a friend that works in the crypto space industry. And I remember him telling me about Bitcoin when it was, I think, $10 a coin.
Yeah.
I look at Bitcoin, it was like 60,000 last year. And I'm always thinking in my mind, okay, like imagine if I'd bought it when it was $10. But then you have to follow that line of thinking all the way, because everyone loves to think, oh, if I bought it was $10 and now it's 60,000, how much money would I make? But let's put it this way. If you bought it when it was $10 and you put $1,000 into it, when Bitcoin went from 10 to 100, would you have held it then?
Hell no.
When it went to 200, would you have it then? 300, 5? When it went to 20,000, you're telling me you wouldn't have sold it? Like everyone likes to think, oh, it was the lowest was here and the highest was here, but you're never going to time it that way. So I personally, and as I mentioned to you, the reason why, you complimented by saying you're so disciplined, but I would retort to that saying, I'm disciplined because I'm ignorant. I don't check. I have no, I read the Globe and Mail every day. I literally skip the business section to get to the sports section. I don't care about the entire business section because I don't care. I don't want to know what's going on. Apple has that like stocks widget and I turn it off. I don't care. Man. So I think your life would be easier to be disciplined if you stop reading so much and stop checking it so much.
I like it.
Yeah. Geez. Wendell, I got to ask you, okay. Can you explain to our listeners what 1%, the average asset manager's fee, it is coming down. It used to be, maybe 2% to 1.5. My asset manager fee is 1%. And depending on how much you have, it goes down from there. What does that mean over 20 years?
So it's a big deal. So
it is a big deal. It sounds like 1%, but it's not.
Yeah. So what you have to factor in is not only the 1%, right? So nowadays, and you identified that, you don't feel comfortable doing this by yourself. And I think that's the majority of people. And I think that's totally okay. As I said, other than the one thing in my life, which is investing, I pay experts to literally take care of every single other thing because I don't feel comfortable doing it. So when it comes to the management fee, you have to look at two things. You have to look at what are they charging you to manage your money, which is usually a percentage of AUM, assets under management. So let's say you have $1 million, they're going to charge you 1%. And then for every dollar after that, maybe they'll charge you 0.5%. Yeah. And that's, you're just paying them. And that's literally, you're just paying them money to manage your portfolio. And that's totally fine. The industry standard is around 1%. If your asset manager is charging you 1%, that's a very reasonable rate for the work that they have to do and the service they're offering you. Where it breaks down is what are they then investing your money in? Because if they're taking your $1 million and you're paying them 1%, right? Which, by the way, is $10,000 a year.
That's right.
So remember that you are paying $10,000 a year. Let's say it was $1 million, and you can adjust based on. So you're paying someone $10,000 a year. You know, really break it down. Actually, how much are you paying this person? Because it'll never show up. They don't send you an invoice. They're very smart, right? There's no invoice that comes and saying, "Please write me a check for $10,000." They just take your portfolio and they deduct it from there. And then they take your $1 million and they invest it in mutual funds with a MER or a fee of 2%, 2.5%, or a 20% commission to them for making you buy. That's where the fees really kill you, is the hidden fees after the 1%. I'm totally fine with the 1% because you should be paying them something to do a service for you. What I'm not okay with is that they then take your money and put it in high fee mutual funds that they get a kickback or commission. I want to pay someone 1% to invest in index funds, low cost, keep my fees down, talk me off the ledge when the market's down 20% and I'm calling you and I want to sell. No, tell me stay the course. I want to pay 1% and say, listen, can I afford to contribute 10,000 to my RSP, or do I need to save that money because my corporate loan, or I want to buy a practice in 5 years, or we're starting to have a family, you know, I just bought some real estate, all these questions. That's what I want to pay my 1% for. I don't want to pay you 1% to then go spend my money on someone else.
For sure.
Oh, we can talk an entire hour about this, man.
Wendell, what about other asset classes? Because, you know, for the listeners that you know don't understand, you can put your money in one of, you know, 100 paths, right? You can put it in real estate, you could put it in crypto, you could put it, I don't know why I laughed there. You could put it in you could put it in stocks. So why pick stocks?
So, you know, back in the day it was very easy because pretty much your options were stocks, bonds, cash, right? And cash, the beauty of it is it's liquid, which means you can access it anytime. If you have $20 in the bank in cash and you need $20, you go to the bank, you get your $20. If you have $20 in bonds or stocks and you want that $20, well, you got to go to your broker. You got to try and sell it. There might be fees, how much money you're going to get. You can't just take the $20 out to pay something right now, right? So liquidity of cash is amazing and it's safe. You know, it's cash. It can't go up or down in value. It is what it is. All that matters is inflation over time, which is obviously very trendy right now. But basically, cash is your safe bet, but it's going to stay the value that it is right now. Then there were stocks, which was considered, you know, a more risky investment because at the time, maybe you were picking stocks. A stock could go to zero, it could go up 10 times. And I think picking stocks was really difficult back in the day because you actually had to choose the equities, the stocks that you wanted to buy. So you'd have to do research. You had to figure out, you know, are they risky? What are they rated? And that's why stockbrokers were so useful. Everything got broken when index funds came along because you could literally just buy all the stocks at once with your $20. And therefore, you don't need to do any research. You don't care if it goes up or down on individual companies because you own literally every company. So when you're at that party and someone says, I own Meta and it went up 27%, you say, yeah, I own Meta too. And then they say, I own Google. Oh, yeah, I own that too. You own everything, right? You don't need to feel left out. You literally own everything. Now, when it comes to bonds, bonds are considered safe. You know, you're investing in a company. Basically, they're buying your money for you and then they're paying you a return. It's like the opposite of taking a loan. It's like they're taking a loan from you. And, you know, they come with levels of safety. So, you know, Canada government bonds, you're lending the Canadian government money. So unless you think the Canadian government is going to default on their loans and their debt, you're going to get the money back. So that's why it's really safe. Whereas if you go down and there's corporations, some of them are super safe, like a bank, and then you get, you know, less and less safe as you work down the ladder. But bonds are considered very safe investments, lower returns. You know, stocks on average, they say you should get 5 to 7% per year return over the long run. Bonds, maybe based on interest rates, you're getting 1, 2, 3%. You know, it's a lot less than stocks. So those were kind of the decisions you had to make. How much stocks, how much bonds, how much cash. And it was pretty simple, to be honest, once you knew what you're doing. A lot of alternative asset classes have started popping up because people, what happens is, as people get more money, they start to think, okay, I have a lot of money now, so clearly there must be a next level, right? I flew economy my entire life, but as soon as I had enough money, I moved up to premium economy. And then when I got really rich, I moved up to business class. You know, I used to stay at Holiday Inn, but now I make a lot of money, so I stay at the Ritz. By the way, when I say I, it's not me. I still stay at the Holiday Inn. I've never stayed at the Ritz, actually. So don't misinterpret this for me. I still fly economy and stay at Holiday Inn.
Buddy.
Okay?
You busted yourself.
So people for investments, they think the same. Okay, I did stocks, I did bonds, but now I got $1 million. Like, what's the next thing? So then they look at things like real estate or crypto or private equity, hedge funds, all these different things. And the problem is, once again, if you go back to the evidence is overwhelming that the majority of people that invest in these vehicles will lose money over time. You will lose money compared to investing in a well-balanced, diversified portfolio in stocks and bonds. And crypto is a great example of a lot of people getting into the space. It's blowing up, and then certain world events can happen and it can crash. So I pretty much avoid all alternative asset classes. The only exception I would make to that is real estate. A lot of people like real estate. A lot of people have had good experience with real estate, especially in the Canadian market, because our real estate market is so ridiculous. So if you're passionate about real estate and you want to invest in real estate, I could see the argument that, okay, there are some benefits to that. For me personally, the reason I've avoided that is I hate real estate. I bought one place. I want to live there. I never want to think about it again. I don't want to be a landlord. I don't want to own something and rent it out. I don't want to keep track of something. I don't want to be called when the pipe bursts and I don't know how to fix it, and it's freezing in Canada or someone defaults on their rent. So I avoid real estate. But that's the one alternative asset class that I think a lot of Canadians do invest in and do enjoy. But I would be cautious in thinking, you're investing in real estate because you think you're going to make a killing. Always go back and compare the money you put into your real estate investment. If you had put that in stocks instead, what would have been the comparator? And remember, your stock portfolio is never calling you in the middle of the night. Your stock portfolio is never defaulting on their rent. Stock portfolio is never needing a renovation or a new air conditioner or the dishwasher is not working. So that's personally where I fall. I don't really do any alternative asset classes, and I don't think they're worth it for 95% of people. I think if you are going to pursue that, it should be a small part of your portfolio, and it should be because it's something you really enjoy and you're passionate about. Like, you enjoy the space. It shouldn't be because you think you're going to do better than everyone else because you're in that space.
Yeah, Wendell, I just bought some high yield bonds, like Venezuelan bonds.
Yeah,
like
okay. Yeah, exactly.
No, I totally hear you. As a guy that has jumped into real estate, and my local economy went to the shitter because oil, went down the tube, and the government and whatever, right? And political, you can talk about that all night, but I was a victim of that, right? And I can tell you firsthand, it sucks when someone doesn't pay their rent, or someone doesn't clean the hair out of the sink, and now it's clogged, and now you got to call a plumber, and that's my fault. You know what I mean?
Exactly.
I 100% resonate with that. But I made my mistakes. I learned from my mistakes. They're not my failures. But what would you tell new dentists coming out of school? Like, how should I have learned about it instead of making all my mistakes? What would you tell them?
So the first thing I would tell someone is that it's okay to make mistakes, just as long as you learn from them, right? We all make mistakes. I've made tons of mistakes, but if you make the same mistakes over and over again, or you're not learning from your mistakes and being honest with yourself that it was a mistake, I think that's where you get in trouble, because you're going to make the same mistakes over and over again, and you're going to keep justifying saying, oh, but it was because of this, it was because of that. So what I would tell people is it's okay to make mistakes. And if I were to simplify this down to one question, anytime you're getting into a new situation as a new grad, ask yourself one question. How is the person across from me getting paid? Yes. What is in it for them, right?
I like that.
Because if you can ask them, when someone comes to the dentist and you recommend a filling, what do they say? They say, okay, why do I need it? You say, oh, I've noticed a cavity. Your x-ray shows this. So we don't want it to lead to infection. We want to avoid a root canal, blah, 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 blah. You're explaining why they should pay you, and they know that you're being paid for that service. So when you then go to a bank, or you talk to a broker, or you talk to an insurance agent, or you talk to a landlord or a real estate agent, you want to know how are they making their money. Because if what they tell you is, listen, I'm a fee-based financial planner, and I charge you $2,000 to look at your entire scenario and give you a plan, and then it's up to you to implement that. Okay, I'm being charged $2,000 for this service. But if they then say, oh, I'm a financial planner and I'm going to manage all your money, and don't worry about the fees because I have a history of returns and you're going to make money, you have to start questioning things. So I think the best way to avoid mistakes is just ask yourself, how is the person across from me getting paid? What is in it for them? And I think that'll help you avoid a lot of common mistakes.
What are some, because dentists love reading and materials and toys, like what are some concrete like books, tools that you yourself would recommend to like a new grad?
So I think literally the best, I'm not even just saying this because Neki brought it up, but I think the best place to start is that Money Sense magazine. So, I have a PDF of it. I have the physical copy. I think it's from 2014 is the latest one. And it's funny because you read it now and literally nothing has changed. The only difference between that book and what you should do in real life is at the time they didn't have the asset allocation ETF. So for those people that don't know what that is, we talked about having a mix. Let's say you want 90% stocks, 10% bonds. Well, a long time ago, you'd have to buy 90% stocks and do all the math on an Excel spreadsheet and 10% bonds. Nowadays, they have funds where you just pick your allocation and they will rebalance, they will buy, they will do everything for you. So I have tons of people since I did that episode, and also just my family and friends that reach out to me asking, oh, investment advice, how do I start? What should I do? And what I always do is I send them that book, I send them that PDF or a link to it, and I say, read this and get back to me. 95% of people never get back to me. Why? Because they don't want to read it. It's a 200-page PDF. Yeah. You could read it in 3 days. Neki's read it probably multiple times, and no one. So that's how I filter out those people. So first, I would say, read the Canadian Couch Potato. That's the best way to start. Then he actually has a podcast, Dan Borlotti. It ended. It was only 23 episodes, but I would say listen to every episode of that. It's really, really entertaining and answers all the common questions. Then you mentioned Ben Felix from The Rational Reminder. He has a great YouTube series. I think there's probably 30, 40 videos. And each one is the title of each video is like a really common thing that you're thinking, whole life insurance. Should I get this? Watch that video. What are index funds? Watch that video. Is crypto a good idea? Watch that video. So I usually tell people, read the Money Sense article or Dan Borlotti's new book that just came out this year. It's kind of a similar updated summary of it. Listen to the Canadian Couch Potato podcast and watch all of Ben Felix's YouTube videos. And if they do those 3 things and they actually do it, I think they've already got a huge head start on kind of their financial future.
How about like you yourself though? Because I bet you get questions and inquiries from young dentists all the time or young surgeons all the time. You're like, hey, can you like mentor me? Does anyone ever ask you, hey, can you like financially mentor me?
It's funny. No one's actually ever asked me to financially mentor them. Even my wife doesn't care what we do. Like even she's not interested in learning. It's just weird. I find it so strange. We live our entire lives based on career progression, promotion, making money, saving money, spending money, right? Everyone loves making money, everyone loves spending money. And then for some reason, we have this blind spot that when it comes to managing your money, everyone just shuts down. No one wants to talk about it. No one wants to address the elephant in the room of what they're doing or what they're not doing, how they're going. No one wants to talk about if they're losing money, gaining money. So I mentor a lot of people, especially teaching at a university in oral surgery and dentistry, but no one's ever actually asked me to mentor them financially. But if they would, I would kind of give them the same advice that I just gave you. I would say, listen to those things, maybe listen to the Rational Reminder episode, listen to this episode. And when you're ready, you can kind of start on that journey. But I do find as I get older, more and more people are now, like my colleagues in oral surgery are starting to kind of get the picture from talking to me a lot or listening to me. We did a bunch of episodes on our podcast about financial planning. So we had one with the financial planner and we had one with Ben Felix himself, where we literally did Investing 101. So it was like a 3-episode divided in 2 halves. And it was literally everything you needed to know about investing if you don't know anything about investing. So I would highly recommend people listen to that. It's the Teeth and Titanium podcast, and look for the one with Ben Felix. It's called Common Sense Investing. And I think after that episode aired, now people in the oral surgery community reach out to me a lot more. And I pretty much tell them what I just told you guys: low cost, broadly diversified index funds, and ask the person that's managing your money, how are you making money?
Man, I think that's great advice for anyone in any stage of their career. Like I said, I've made so many mistakes, but if I could do it all over again, I 110% agree. I would have taken your approach. Can you spell out for a new grad, I don't know whether you open up a Questrade or any direct investing, low cost account. What is the name of the broad-based ETF or index fund that you're purchasing?
Yeah, for sure. So nowadays there's a lot of asset allocation ETFs. Basically, the ones you need to know about are, Vanguard would be VBAL, for example, would be 60/40 portfolio is VBAL. With I think BMO it's ZBAL, and then with iShares it's XBAL.
Yeah.
Then there's the ramp up. So if you want 80% stocks, 20% bonds, it's VGROW, XGROW, ZGROW. But I think the easiest way to look these up is if you look up Vanguard asset allocation ETFs. And then you can kind of choose which one matches where you are. And it's based on your age, based on your risk tolerance, based on the money you want to invest. Basically, if you're young, you want to favor more stocks. If you're old, you want to favor more bonds. And that's kind of the one you pick. As far as where to buy it or how to buy it, there are a lot of online options now where it's free, like Questrade you mentioned. It's free to buy ETFs. You're not paying it. But I always caution people to realize what free means, meaning for Questrade, you open an account, you got to manage it yourself, you got to link everything yourself, and then you're going to buy VBAL, and it's going to cost you $0 to purchase it, right? My bank is CIBC. I have no conflict of interest with CIBC, but I open my discount brokerage account through them. That way, on my online banking, I click investing. It's all just right there. It's just a convenience thing. But for each trade, I pay $7, right? That's what their fee is to make a trade. Now, someone's going to say, "Oh, you're paying $7. You could do it for free. What are you doing? This guy's so stupid." How many trades am I making a year? One for the RESP, one for my RRSP, and one for my personal account. Was that $21 a year I'm spending? It's nothing, right? Yeah. So I think the most important thing to do is look up the discount brokerage account with the bank that you're currently with. If you're looking for a free option, probably Questrade would be easy. But what I would caution people is if you're new to this and this is the first time or you're trying to learn, no one says you have to do it yourself at the beginning. Get an asset manager, pay them 1%, as long as you're doing things the right way. And then over time, as you learn more, as you get more comfortable, you can start to do more and more yourself. But the problem I think a lot of people have is they try and do it themselves from the beginning. They get overwhelmed or they make bad choices and then they get shy. There's a lot of people that sign up for an account, make a purchase, see it go down, sell, and then they are never in the market again. So it's really, really terrifying for a lot of people.
Oh man, Wendell, I don't mind sharing the story because I love when people laugh at me. And so as soon as I graduated, I paid off my student loans and I still had a bit of a line of credit, but I'm like, you know what? I'm 20, 24. I should start investing. I didn't know how. So I went to my asset manager, my local asset manager at a, big 5 bank, and he put a ridiculous amount of percentage of my money all into oil.
Oh, wow.
2015 hit. What happened in 2015? We got decimated. What happened to my entire portfolio? And it was just such a great lesson because you don't know who to trust.
Mm-hmm.
And you know what I mean? And sometimes you don't know until it's too late. But if you are going to go down this road of doing it on your own, which I do a lot of it now on my own, and I still have an asset manager, but when it comes down to putting money into your Prof Corp and growing it by investing in your Prof Corp, or still putting money into an RSP, like how do you decide?
Yeah, so this is one of the age-old debates is, keep retained earnings in your corporation or pay yourself a salary or dividend, pay the taxes, and then don't contribute to your RSP. There's pros and cons to both sides. This is one of those ones where I'm not a tax expert and I can't map it out. So what do? I ask my financial planner. I say, map it out for me. Should I keep this in my corporation or should I contribute to my RSP? In the end, the broad view summary would be there ends up being a lot more benefits to contributing to your RSP in the long run. So a lot of people do favor that. A lot of financial planners do favor that. You want to get some money out of the corporation because, if you're incorporated, you're owning a business, things are going well as a dentist, the retained earnings of your corporation is going to start to increase over time. So it's a first world problem, but one of the problems you end up having is how do I get money out of my corporation, in the most tax favorable way possible? So that is a question that I literally asked my accountant and my financial planner. I said, map this out for me. And they're great. They're experts. They pull up an Excel. They show you this was your last year. This is how much you would contribute. This is the tax brackets in Ontario. This is what you'd be paying. I asked them questions like, should I keep money in my corporation or should I withdraw it to pay off my mortgage? Or should I pay my corporate loan? What is costing me the most money? And they will map it out and tell you, well, listen, if you withdraw more money from your corp, you're in a higher tax bracket. But because you're wanting to pay off your mortgage and get rid of your debt, you'll actually save this amount of money in the long run. You know, my mortgage is a fixed mortgage. My corporate loan is a variable loan or variable rate. So now that the tax rate has been going up so much, they told me it actually makes more sense, even though corporate interest is tax deductible, to pay off your corporate loan first before your mortgage. Because my corporate loan, the interest rate keeps going up because they keep jacking up the interest rate, right? So these are questions. These are great questions for an accountant or financial planner. I think when you make your team of your lawyer, your accountant, your financial planner, it needs to be people comfortable with corporations and with dentists, because our world is a different world. We're not even family physicians, right? Family physicians, they bill OHIP, they get paid by OHIP. We are small business owners with 5 employees, 8 employees, 30 employees. We're a business. You need someone that understands the business of dentistry and all the tax implications that are involved.
Man, I kill. Has interest rates started to kill you yet?
Uh, well, I mean, listen, it's 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 a touchy subject. It's a touchy subject.
Because the student line of credits, I guess, are variable, right?
Yeah, unfortunately. So, but what's interesting though is, when I look amongst, my cohort or even just the new grads, everyone has 24 hours in the day, right? And people's brains all over the place. And I often hear, whether it be financial podcasts or, water cooler talk, people think they're being financially savvy by not buying that $4 latte, or they're focusing on the wrong things. What are the things that you think are of the highest importance that, let's say an early career, early stage dentist should focus on?
2 things for sure jump out to me right away. Number 1, debt. Debt costs you so much money in the long run. People don't understand that saving $20 and paying off $20 in debt are not the same thing, right? You need to look at your debt. You need to look at the interest you're paying on your debt and how much that is actually costing you a month. So you brought up, the $4 lattes. I wish we lived in a world of $4 lattes. I like Starbucks. A latte is like $7 now. It's crazy, right? And I think people are wasting time by trying to nickel and dime on their coffee or their lattes, avoiding a gym membership, canceling Netflix. Those things are not going to matter in the long run. And those things might bring you a lot of enjoyment. Like, why suffer, right? So I go to Starbucks. I enjoy that. What is going to kill you is debt and savings. So all the evidence for young people growing up shows by far the number one most important thing, beyond fees that we talked about, beyond what you invest in, beyond everything else that we talked about, is your savings rate. The more you save, especially when you're younger, the more money you will have when you're older. And it's like exponential. It's crazy. I don't have the exact stats in front of me, but they always do the one where if you save $10,000 when you were 25 versus $10,000 when you were 35, like it's 10 years difference. And I think you end up with like $300,000 more, or a million. Like, it's just crazy what the stats are. So the 2 things I would caution people are debt. Don't take on a lot of debt and pay off your debt as quickly as you can. And number 2, savings. Get in the habit of saving money earlier on so that when you're making more money later, you have that built-in habit of saving. I think it's important to recognize what you enjoy and what you enjoy spending money on, and to not deprive yourself of everything. My personal weakness, I love travel. When it comes to travel, I love going to a nice place. I love a direct flight. I don't want a layover. I love, I'm still in economy, but still, I love staying at, a nicer hotel or going to a nice restaurant, enjoying the culture, maybe paying for a private tour guide instead of a group tour guide. Like, that's my guilty pleasure. I love traveling, right? So I'm not going to nickel and dime on that, but at the same time, I'm aggressively trying to pay off my loans, pay off my mortgage, get out of debt. I drive a basic car, I don't need anything fancy. So I think avoiding debt and a high savings rate goes a long way for people. And you'll start to see, instead of paying so much money back now in interest, you're starting to make a lot of money on your savings. And it's a rewarding feeling. You feel good about it.
Man, it's compound interest at the end of the day, right?
Yeah.
And so the younger you are, the more you'll have. And I believe Warren Buffett made most of his money after the age of 80.
Yeah. I think it's like in the last 5 years, he made all his money. It's crazy. They show his income, and it's just exponential right at the end. It's just compound interest,
Totally. Yeah. No. Hey, I wanted to talk to you. Can you tell us about Teeth and Titanium, your podcast?
Yeah, for sure. Thanks. So I listen to a ton of podcasts. I mentioned I listen to your podcast. I listen to sports podcasts. I listen to finance podcasts. I listen to a lot of different podcasts, and I just really enjoy them. I like listening to people I find entertaining, and I find it good for drives or at the gym or going for a walk. I really, really like them. And what I realized when I was in residency was there was not a podcast for oral surgery. So I brought it up with my buddy and I talked about it. But as I said, residency, you have no time. You don't have time to do it. You don't have time to research it. You don't have time to produce it, edit it, all that type of stuff. And what happened is in my chief year, COVID started happening. And all of a sudden, everyone's on lockdown. You got nothing but time. So I told my buddy, I said, now might be a great time to start a podcast. We can't go out anyways. And so we started a podcast. It's called Teeth and Titanium. It originally was meant for oral surgery residents and oral surgeons. But in all of Canada, there's only about 400, 450 in Canada. And luckily, our listenership has really grown. It's way more than that now. So we know people that are not oral surgeons are listening. I got an email from a dental assistant in Australia this week saying she listens to every episode. And even though she's only an assistant to an oral surgeon, she loves it because she's learning more about our profession. So we do it every month. Every episode's kind of similar where we do a journal club. We talk about a journal episode. We do a resident reminder. So we take one kind of topic and explain it to a junior resident, a senior resident, and the staff. We always have current events talking about what's going on in our lives. We do recommendations of TV shows or whatever we're watching. And then similar to this, every other episode we'll have a guest on. And we try and bring someone on that's entertaining or specializes in a certain thing. And it's not always oral surgery based, like that is our, our listener base, but we do try and get, we had a financial planner, as I said, we had Ben Felix for investment advice. We're trying to get someone on for incorporating and, the do's and don'ts of that. All these different things. We'd love to get someone on for, how to live a balanced life, what to do outside of the profession, how to avoid burnout, all those types of things. So I really enjoy it. It's once a month. It's a ton of work. Your podcast is a ton of work and you guys know that firsthand. But yeah, for sure. If anyone wants to check it out, it's called Teeth and Titanium, which is ironically a nod to obviously oral surgeons, what we're known for, teeth and titanium, wisdom teeth and dental implants. But as I told you before, I try and do more than that when I'm not in the office. But in the office, that's what it is. That's the bread and butter, teeth and titanium.
For sure. Yeah. And to your point, like I just love the podcast that I follow a lot of podcasts as well. Now more into the audiobooks, but follow a lot of podcasts. And I just love when like people just talk about daily things. I find that so much more therapeutic than having, information just being flinged at me, all day long, which I think is probably if you look at some of the other OMFS podcasts, they're probably highly clinical, highly technical, which is, it's an interesting take that you kind of talk about your TV shows because I think that's so important. But how did you get the Canadian Association of Oral and Maxillofacial Surgeons to support it? Because I know that's no small feat.
Yeah, so I'm on the executive committee of the group. Actually, at the time when we started, I don't think I was on the executive committee. Now I am as the membership chair, but at the time I'd known the people on the executive committee. And basically, the executive committee is a group of older, more practiced, more seasoned surgeons. Maybe they've been working 20, 25 years. And they're amazing at their profession, amazing at surgery, but they didn't grow up in the social media environment. They didn't grow up with all the different apps and the internet, all that different stuff, right? So to them, they're now trying to branch more into social media and marketing. Marketing, our specialty as a whole, explain to people what an oral surgeon is, because until I was in first year dental school, I'd never heard of an oral surgeon, right? How many of your relatives even know what an oral surgeon is? Most of my extended family doesn't know what an oral surgeon is, right? I have to explain it to them. So,
fancy dentist.
Exactly, yeah. So we are trying aggressively as a organization to promote the specialty of oral surgery, not as individuals, but just as a specialty. And I came to them and said, listen, I'm interested in starting a podcast. It's going to be about oral surgery. I'm going to do it regardless, but I'm asking you if you would support it because it would help a lot to have your support, your clout, your credibility behind this. And then it would help cover some of the costs of hosting and editing and promotion and things like that. So I basically made an episode. We made one episode. We sent it to them. The executive listened to it. They loved it. And they said, let's do this. We'll do it once a month. We'll support you. And now the way it works is we record the episode. We get it edited down. We send it to 2 people on the committee. They listen to it first. And as long as it passes kind of their screening test, we publish it to the world. So that's kind of what we do every month now.
Yeah, that's so awesome. Wendall, it's been an absolute treat. Thank you so much for coming on our podcast. And, I got some great financial tips from you, and I hope some of the newer dentists that may be listening, heed your advice and go the broad-based index fund way, because you're totally right. That's where the data lies. And if only I listened to you 15 years ago, my friend. But anyways, Wendall, thank you so much for coming on.
Yeah, thanks for having me. And as I said, I could talk to you guys all day about this stuff, but it's been a real honor, and I appreciate you guys reaching out, and it was a lot of fun.
Welcome to the Hi, I'm Neki. Is that a
What's up,
sweater?
Yeah, dude. Dude, it's the Hi, I'm Doctor sweater. Oh, dude, I see you got yours on too. Looking sharp, bro.
Dude, where'd you get yours from?
It was super easy, man. I just went on to our website, www.hiimdoctor.com. That's HIIMDR.com.
We have a website. We must be raking in cash from selling these sweaters.
Dude, we are killing it. I mean, if that includes losing money on every single sweater that we make, I think we're doing really well.
Yeah, Neki and I are donating all proceeds, which is 0, to charity because we are losing money.
I wonder if the charity will pay us. I think we got something here, man. Let's keep on keep on losing money on every sweater.
Alrighty, guys, go check us out. HiI'mDoctor.com.
We'll see ya.